Neem, Mwarobaini. Evidence-based uses and critical safety concerns. Neem, known as Mwarobaini in Swahili, is a widely used traditional remedy with growing scientific attention. While preliminary research suggests benefits for oral health and antimicrobial activity, concentrated neem oil carries serious toxicity risks, especially for infants and children. This article summarizes current evidence, practical applications, and essential safety considerations. Traditional use and key compounds. The neem tree, Azadirachta indica, is native to Africa and the Indian subcontinent and has been used for centuries in traditional medicine. Its leaves, bark, seeds, and oil contain compounds such as azadirachtin, limonoids, and terpenoids, which contribute to its biological effects. Modern pharmacology confirms these substances exhibit antimicrobial, anti-inflammatory, and insecticidal properties. Notably, azadirachtin is a powerful insect repellent and growth regulator, but its broader application requires careful risk assessment. What the research shows: oral health. Strongest evidence base, the most consistent clinical evidence, supports Neem's use in oral care. Neem-based gels or mouthwashes have demonstrated comparable efficacy to chlorhexidine in reducing plaque, gingival inflammation, and microbial counts in short-term trials. While most studies are small, converging findings suggest Neem can be a useful addition to standard oral hygiene practices. Antimicrobial activity. For clinical support in laboratory studies, Neem extracts show broad antibacterial activity against various oral pathogens and other microbes, with notable effects on biofilm formation. However, these findings are primarily in vitro or in animal models, meaning their direct clinical relevance outside oral care remains unconfirmed. Emerging signals. Inflammation, metabolism, liver health. Preliminary research suggests potential anti-inflammatory, antioxidant, anti-diabetic, and hepatoprotective effects in preclinical models. Some newer studies explore Neem's ability to protect the liver from oxidative damage. However, robust randomized human trials are lacking to confirm these benefits beyond oral applications. Practical uses and formulations. Topical. Leaf or bark pastes, diluted neem oil, or commercially formulated gels can be used for minor skin issues. Oral care. Neem-based gels or mouthwashes show the strongest clinical evidence for gingivitis and plaque control. Biopesticide. Azadirachtin-based products are effective insect repellents, though environmental concerns, aquatic toxicity, stability must be addressed. For everyday wellness, the most evidence-backed use remains adjunct oral care. Broader systemic claims require higher quality human trials. Critical safety concerns. Toxicity risks. Neem is not without risk, especially when ingested in concentrated form. Infant and child toxicity. Multiple reports document severe toxic encephalopathy and mortality after oral exposure to neem oil in infants and young children. Ingestion should be strictly avoided in this age group. Adult toxicity. Case reports describe vomiting, metabolic acidosis, seizures, and encephalopathy following accidental or intentional ingestion of neem oil in adults. General toxicology. While some animal studies suggest certain dosages may be safe, others demonstrate toxicity, highlighting the need for standardized products and dosing guidance. Practical cautions. Avoid internal use of neem oil. Keep all neem products away from children. Pregnant or breastfeeding individuals should avoid internal use due to insufficient safety data. If considering oral supplements, consult a healthcare professional, especially if you have liver disease, medication interactions, or planned surgeries. Research gaps and future directions. Larger, longer-term randomized controlled trials are needed to confirm systemic benefits beyond oral health. Standardization of neem extracts, marker compounds, dosing, quality control is crucial for consistent clinical translation. Increased pharmacovigilance and community education on pediatric risks are also essential. In conclusion, Neem Mwarobaini remains a culturally important remedy with promising antimicrobial and oral health benefits. However, the evidence base supports topical and oral care applications most strongly. Systemic claims require further research. Given real toxicity concerns, particularly with neem oil ingestion. Users should prioritize standardized formulations and consult clinicians for internal use.